Hi, it's Dr. Eric Balkavage. We're back for episode 4 of the Peripheral Neuropathy and Diabetes Learning Series. Today I want to talk about the second of the 6 mechanisms that I talked about in episode 2 that cause peripheral neuropathy. So this one is called covalent modification, or changes in covalent modification. And what happens in this part of the neuropathy process is that things like hyperglycemia, this high blood sugar, causes an increase to something called advanced glycolated end products. We call them AGEs. And these AGEs are like sticky substances. They're like molasses that kind of sticks to stuff. And when stuff is sticky, it doesn't work as well. And so what happens is, as you bind these AGEs to proteins and enzymes, it changes the functions. If you glue these things onto vessels, you'll damage the tissue, because you get the immune system that comes as these AGEs bind. There's damage to the tissue. The immune system responds, and as the immune system responds, we develop plaque that builds up around this, and we blame cholesterol for it, but it's really these glycolated end products that actually create the problem. Once you have this buildup occurring, you get narrowing of the vessels, and as you get narrowing of the real teeny tiny blood vessels to the peripheral nerves, it creates hypoxia, or decreased oxygen to these tissues, decreased blood flow, and our nerves die. So the smaller these nerves are, or the smaller the vessels are, the more damage can occur to the nerves. So small nerves, small vessels. You start narrowing these really teeny tiny vessels, you can't get oxygen or blood flow through the blood vessels, and the nerves essentially die. The other thing that happens when you have the accumulation of these AGEs is that it decreases something called endothelial nitric oxide. So these advanced glycolated end products actually inhibit the release of something called endothelial nitric oxide. So what does that mean? Endothelial nitric oxide is a type of nitric oxide that helps vasodilate, or open up our blood vessels. Okay, so if these advanced glycolated end products decrease endothelial nitric oxide synthetase, that's the enzyme that actually produces endothelial nitric oxide. So if that occurs, we get vasoconstriction. The blood vessels don't dilate. When we have vasoconstriction, we have increased blood pressure. What happens when you have increased blood pressure? You get put on a blood pressure medication. Some of those decrease the pressure, the pumping capacity of the heart, and decrease blood flow to the extremities because it decreases the pressure. The other thing, as you narrow the blood vessels, you get vasoconstriction. Blood flow can't get to these teeny tiny nerves through these teeny tiny blocked vessels, and you get nerve cell death. The last part I want to talk about is these AGEs can actually damage the laminin. A part of the neuron gets damaged, and that actually inhibits neuron regrowth, so the nerve cells just can't regrow. So you have damage, these glycolated end products change and damage tissues, creates hypoxia, or decreased blood flow, and it damages the nerve directly, so it can't heal and regrow. So really bad stuff going on when there's covalent modification, especially when it's triggered by hyperglycemia. All right, that's it for today's episode.